Hello, I am Dr. Richard Semelka. I am the medical doctor whistleblower. I'm speaking to you for the first time today publicly about my situation, and primarily I'm speaking on behalf of the victims involved. So there's really three reasons that I'm speaking out now for the first time. It's been 5 years since UNC senior administration initiated the dismissal of myself from faculty. And it occurred to me that with the time being spent on waiting for legal action, the people who are forgotten in all this is actually the victims who I spoke up to senior administration at UNC of the injuries that they sustained. So it's primarily for the victims I'm speaking of now. Also, it will address in part a subject that has actually haunted Ali Raceman, the well-recognized Olympic athlete. She's mentioned on a number of occasions, and I think it's been something that has haunted her, that if only one adult had spoken up in her case, that she would not ever have met Larry Nassar. So my case actually will illustrate that it's not one adult who's needed to speak up at an organization, but actually who needs to speak up is somebody who's very famous, like Ali Raceman. My case illustrates it, and I'll get into that a little bit. I really want to keep the focus, though, on the victims. So this is the account. Essentially, I found out from the program director of the radiology residency program, and those are the radiologists in training, Bob Dixon, informed me that when he was a fellow, now this would date back to around 2000 or so, he spoke to the chairman of radiology because one of the faculty members, Paul Jaques, had shown up to work in the morning drunk and was operating on patients. Bob said he went to speak to the chairman, Matt Mauro, and what did Matt Mauro do? But nothing. Left Bob Dixon and left Paul Jaques to continue to operate on patients drunk. So when I heard that as the vice chair of quality and safety, that to me was a crossing of the Rubicon moment. That is unacceptable. It's unacceptable in the US, it's unacceptable in any country. So I did due diligence by speaking to other senior faculty members in interventional radiology. So I spoke to Joe Stavas, who was initially hired some years earlier than that, so sometime around, I guess, 1998 or so, was hired to be the division chief of interventional radiology. 2 weeks after he was hired, the chairman at the time asked him to fire Paul Jaques because Paul Jaques was drunk at work. So Joe Stavas and the chairman of radiology met with Paul Jaques, and Joe Stavas had been asked to say to Paul, you have to be let go because you've been drunk operating on patients. Paul responded, I'm going to sue. The chairman of radiology then decided to drop it. So I spoke to Joe Stavas, and he told me that story. Joe, since that time that I spoke to him, so about 2017, Joe then went to Creighton University to become the chair of radiology. I then also spoke to Lauren Burke, who was married to Charles Burke, who at the time of my inquiry was the current division chief of interventional radiology. And he confirmed, or better to say, Lauren Burke, and I asked her, did you know that Paul Jaques was coming to work drunk? And she said, yes. I said, did your husband, Charles Burke, know that Paul Jaques was coming to work drunk? And she said, yes. So I actually brought all that to the attention of the dean's office, and I said, this is not acceptable. You cannot have a situation like that. Something has to be done for the victims. Some sort of restitution for the victims has to be done, and a policy change has to be made to prevent drunk physicians from operating on patients. Let's take a step back for a minute to look at the bigger question. Why do people do bad things? Well, they do bad things because they can get away with it, quite simply. If we look at the history also, the recent history of misconduct, and I think a best example of that is probably the Roman Catholic expose that was made in Massachusetts by the Boston Globe in the Spotlight investigation. And what they observed is approximately 5 to 6% of Roman Catholic priests were pedophiles. Well, it turns out if you look at all professions, probably 5 to 6% of all professions are individuals who are engaged in some sort of criminal activity. About 5% of police officers, 5% of people in the military, 5% of attorneys, and certainly 5% of physicians. The primary responsibility of senior administration is to make sure that individuals are safe. Make sure the faculty and staff are safe, and primarily to make sure the patients are safe. Well, I know for certain, based on the information directly given to me by people who know, senior radiologists in the department, that Matt Mauro was aware that Paul Jaques was operating drunk on patients. I estimate for at least a decade, from 1998 to 2008, and he was eventually discharged because the chair of surgery at the time, Tony Myers, observed him being drunk operating on his patient, insisted that Paul Jaques be fired immediately. Paul was fired with a sizable severance package because I guess his attorneys said that he wasn't given the opportunity to recover, and I think there is merit to that point. So, getting back to the question about Ali Raceman raising about the one individual, let's look at my case. I've written over 350 peer-reviewed articles. I've written 16 textbooks, including the textbooks most widely read over the entire world on body MRI. I also, as it turns out, wrote this small textbook on healthcare reform in radiology, where I address safety issues in radiology. Amongst those 350 peer-reviewed articles, many of them major, I've also written more articles on safety in radiology and the broad spectrum of safety issues in radiology than any radiologist in history. I was vice chair of quality and safety for 10 years, tenured full professor for 18 years, tenured faculty for 24 years. I brought to the attention of the dean and then the chancellor about serious misconduct, asking them internally to correct it. Something had to be done to compensate the victims. Something had to be done to change policy, to create a policy. I also gave them the example of using the University of California policy of drunk physicians. So, of course, what happened is that, the obvious thing happened. They figured out some phony charge to get me fired on. So, the answer then to Ali's question is that why nobody spoke up? And if you think about all of the recent major medical misconducts of 2 university gynecologists in Southern California universities, sexual misconduct with patients for years. Another one in New York. Larry Nassar, of course, in Michigan. Throw in Jerry Sandusky at Penn State. Why did nobody speak up? Why did nobody speak up? There had to be at least 20 people in the Larry Nassar case, at least 20 people at University of Michigan State who would have known. In my case, at the University of North Carolina, probably at least 150 people were aware of Paul Jaques operating drunk. In fact, the technologists in interventional radiology, they would hand down from generation to generation to the residents stories of Paul Jaques. So the story actually that was related to me by the chief resident at the time, who we'll call Roy, he told me the story where Paul Jaques would have a patient put to sleep in advance of the operative procedure and would start smoking and drinking inside the operating room, if you can imagine that. And, in this modern age, when we think of how justice has been changed based on the fact that there was a cell phone documentation of gross misconduct, had there been a video recording of Paul Jaques drinking and smoking in the operating room, you can be certain that all of the senior administrators who've been involved in my case probably would have been, and honestly should have been, and should be, dismissed. So this is the greatest misconduct in modern medical history. Paul Jaques operating drunk at least 1 decade, probably 2 decades. This would involve in the neighborhood of 5,000 to 10,000 individuals. And I estimated, and I actually told the chancellor, and I wrote in my letters to the Board of Trustees and the Board of Governors, probably a minimum of 100 people would have been killed by Paul Jaques by the virtue of the fact that he was drunk when he was operating on them, and perhaps many hundreds more permanently injured. Now, what makes the story particularly nefarious, of course, is that senior administration was well aware that this was going on the whole time. What also is particularly nefarious in this case is that, unlike the situation where gynecologists were sexually molesting patients, they kind of knew, the patients, that they were being sexually molested. They knew that. They were right there. In interventional radiology, the contact with patients is very brief, maybe a one-time event, so patients would not be aware. So the nefarious aspect of this case is the victims would not know that they're victims to this very day. So perhaps the most analogous medical misconduct, and of similar numbers, is the pathologist in the VA system in Arkansas, Robert Levy, who was drunk interpreting pathology specimens and made several gross errors. Now, of course, one of the major differences is that is causing death in a passive way, not directly, actively, whereas with Paul Jaques, he was actively operating on patients. So let's for a second look at what is interventional radiology. Most people wouldn't have any idea what they do. Well, it turns out they do the most life and death procedures oftentimes in medicine. And the case that I illustrated in my own faculty hearing is that imagine that your daughter or son, 18-year-old, was in a serious car accident with a major pelvic fracture, lacerated, cut the internal iliac artery. The treatment, of course, the current treatment, the optimal treatment, is for interventional radiology to occlude the bleeding vessel to stop the patient from hemorrhaging and dying. Well, if someone is drunk, doing a technique that requires incredible manual dexterity, then if the patient dies, well, did they die because they couldn't stop the bleeding, or did they die because they were operated on by a drunk physician? And that's what I'm concerned about, and what I'm concerned happened on a number of occasions, at least in the hundreds. So what do? They open up blood vessels, they prevent bleeding in other blood vessels, they treat liver cancers by injection of various drugs, they increase the blood supply in the livers. They do many surgical procedures which require the greatest manual dexterity of virtually everything in healthcare and the most life and death procedures. So I did not interview any of the senior technologists in interventional radiology, and they would know, and they were there, they would know what happened. I also didn't interview who at the time would have been the director of nursing and of technology in the Department of Radiology, Joanne Stubblebine. These people should be interviewed. Now, I of course worry that as my case is delayed and the the attorneys opposing me still have the opportunity to have the case dismissed, that the victims will be all forgotten in the sands of time. The technologists who were there seeing what was going on, they'll have either all retired or all have died from medical radiation-induced cancer. Who knows? All gone. But I don't intend that the victims be forgotten. These are citizens of North Carolina, citizens of Orange County and surrounding counties primarily. Many of these people are of limited economic means who would be treated in the state institution like University of North Carolina. And they would be people of color, but also white people as well. A lot of these everyday people going in for treatment, not knowing that they were being operated on by a drunk physician, when not only was the physician drunk, but the supervisor also knew that the physician was drunk. And that actually is something that we don't have in any of these other cases as well. Not only do we not have whistleblowers, but not direct evidence that the actual supervisor knew exactly what was going on. So, in short, why don't people then speak up? Why are there not any other whistleblowers other than me that I can think of in medicine? Now, in the meantime, of course, there have been some really prominent political whistleblowers. And these are whistleblowers, again, who are not the victims themselves, but people who speak up on the part of the victims. And that's a different group of individuals altogether, because they have no real pony in the race. They're doing it to help other people. Why don't more people want to help other people? Well, I think my case illustrates it, actually. My level of accomplishment, I'm not just one adult. I'm probably in the top 0.1%, maybe 0.001% of academically accomplished physicians. A pristine HR record, incredible level of accomplishments, and yet discharged on a phony charge. And I didn't want to talk about myself, but I kind of have to contextualize it a little bit, because it's unbelievable, and I hope you're sitting as you hear this. The original charge against me was that I hired an attorney, an outside attorney, for personal reasons and not university reasons. And I'm thinking, how is it possible that somebody's standing up to protect the public in North Carolina? How is that personal reasons? So I think actually also the antagonists realized that. So at some point, and I didn't actually recognize it, the charge against me is now changed, has morphed into that I didn't tell the director of radiology, who's not a physician, Bob Colicchio, I did not tell him enough or anything of why I hired an outside attorney. Now, I actually brought with me and have here the records of my faculty hearing where they were discussing whether or not I should be discharged. But regarding whether or not I spoke to Bob Colicchio, this is the only near contemporaneous accounting of this, of our exchange. Although at my hearing, Bob Colicchio did say that I said something to him that was very disturbing, something to that effect. But these are actually my words under oath at my hearing. I said, I actually met with him in person, August 8th, 1 p.m. in his office, and told him everything. So that is the only near contemporaneous account. And actually, at this time, I wasn't addressing that new charge. I was addressing the original charge that I was doing this for personal gain. Somehow protecting the public of North Carolina was my personal gain, which, I mean, it's also, it's so absurd. It's the sort of thing you imagine maybe generals in Myanmar might come up with a charge like that against Prime Minister, or maybe in Belarus you might hear a charge like that, or in North Korea. But this was not in North Korea. This was in North Carolina that these preposterous, ridiculous charges were brought up. And what is somehow equally ridiculous is that somehow even the judges to date have been thinking that the charges were legitimate, which is hard to imagine when you're faced with a highly accomplished physician saying this is the worst medical misconduct in U.S. history. And I have the credentials to say it. Very few people would have those credentials. I have written so many articles on safety, more than any other radiologist. Do I know about safety? Absolutely. Is there anybody who knows more? Probably not. There's probably people who would be similarly able, but this is not a 17-year-old saying that he saw a videotape of another 17-year-old talking about his guns and, see something, say something, do something. I was a most qualified physician, seeing something, saying something, doing something, and the end result, I was fired. So why did nobody speak up in Ali's case? They simply knew intuitively that what happened to them is what happened to me. And I'll tell you what happened to what is process still happening to me. It's like siege warfare. 5 years into this, I've spent in excess of $200,000 on my case. When will this even be? And it's certainly, there's no guarantee it will be decided in my favor. There's always bias, certainly on behalf of universities. Will it be another 5 years? Will it be another $300,000, $500,000? So they knew if they spoke up about Larry Nassar, who was in great popularity and very successful at the time, they knew that what would happen if they spoke up is they'd get fired. If they contested it, it would cost them hundreds of thousands of dollars in many years. So of course nobody's going to do that. Nobody would do that. That's why it seems I'm the only medical whistleblower, because nobody would want to subject themselves or their family to that. But I hope to change that. I hope that this will be the Gretchen Carlson moment for bystander whistleblowers to speak up against the misconduct that goes on in institutions. And the problem is that, as I said earlier, only 5% of people are criminals. 95% of physicians, 95% of the physicians at UNC are wonderful. I know many of them, excellent, good doctors. But if leadership fails on dealing with the 5% are criminals, then it tarnishes the entire institution. And that's what they didn't seem to understand was one of the crucial issues that I was bringing up. The 5% can tarnish everything. The responsibility of leadership is to eliminate the ones that they can eliminate who are criminals, but the other ones, by having a culture of integrity and of looking after the welfare of patients, by creating that culture, then it puts people who have the tendency to act in a bad way to be on guard and not to feel that they have license. But if you let bad things happen, then as I said to begin with, people, if they can get away with things, they'll get away with things. So things have to change. The first and obvious thing, many of these institutions that I've been talking about that have come to the news are state institutions. And what do they benefit from? They benefit from sovereign immunity. And what is sovereign immunity? I thought in 1776, that's why the U.S. separated from Britain, is to get rid of sovereigns. It allows universities to act like organized crime syndicates. They basically have no restrictions. So they can do things like fire top academic physicians if they speak up about misconduct, and they have full license to do it. So the first thing to do is eliminate completely sovereign immunity. I mean, that's just, it's ridiculous that it should even exist. That has to go. The other thing is that many people speak up about systemic change. In fact, there was 5 females who'd reported mistreatment and abuse at UNC. And one of them, at the end of it, said, there has to be systemic change. And a lot of people have said systemic change. Well, what is systemic change? I'm going to tell you now what systemic change is. First, calling out the perpetrators, not only the ground floor perpetrators, but the administrators who allowed this to happen. Second, they have to be dismissed, fired. Third, a number of them have to be sued. And fourth, some of them have to be in prison. If none of these things are done, then the situation will continue unchecked. There has to be effort put to control misconduct. And senior administrators who allow it to occur have to be held to account. Now, some of it happened with some of the institutions I mentioned, but not enough and not with sufficient severity. Something has to be done to change the culture in universities that allow this sort of laissez-faire, because that permeates everything. It allows people who have the tendency to conduct themselves badly and to mistreat patients, it allows them license. They can get away with it. That has to stop. And I just want to finish by saying this. The victim in Elizabeth City, North Carolina, the group associated with that individual talked about transparency and accountability. That's what I'm asking for here. Transparency and accountability. Investigate, speak to the interventional radiology technologist, Joanne Stubblebine, interview again the people spoke to me. Bob Colicchio, right now, their entire case rests on the hope that Bob Colicchio will lie about speaking to me. That he would have to lie for their case to work out. They're anticipating that he will lie. I don't think so. I don't think he will lie. Transparency and accountability. The victims of Paul Jaques are crying out in their graves. The victims of Paul Jaques are crying out in their graves for justice. Thank you. I'm Dr. Richard Semelka.